Hello and welcome to DAV's podcast. Many American veterans struggle with loneliness. Over half feel lonely at least sometimes, and a striking 1 in 5 feels lonely often. This loneliness is connected to serious problems with both mental and physical health, making it harder for veterans to function in their daily lives and even contributing to suicidal thoughts. Because of this, it's crucial to find ways to prevent and address loneliness among veterans. In today's podcast, DAV's Elizabeth Stetler discovers how veterans can combat loneliness and even how those around them can help.
Karen Owoc is a clinical exercise physiologist at the Palo Alto VA Medical Center. She's also a preventative cardiology specialist and a best-selling author, speaker, and coach on functional longevity. Welcome, Karen. We're so happy to have you.
Well, thank you so much for the opportunity.
We would love to talk today a little bit about veteran loneliness and the isolation that happens within the veteran community. I wanted to start by just asking how you got started working with veterans and in the VA in general.
My background is in cardiac rehab. That's been my career. And I was working in the hospital setting, and then I came across the VA, and they were starting a program that was remote. The Office of Rural Health is the one that actually started the whole program. And the beauty of that is that it reaches out to veterans that don't have access to the hospitals, nearby hospitals. They are in rural areas. And what I found that is it's really interesting how they respond so well. I wasn't sure how it was going to work out. I'm just so used to being in a group setting, in face to face. Wasn't sure how it was going to work out over the phone or on video, but it's been phenomenal. I've seen the veterans really turn around and open up by having that one-to-one contact versus being in a group setting.
What experiences have really shaped your understanding of the challenges that veterans face, particularly around loneliness and mental health?
So the veterans, one of the things when I do the intake, the initial intake, not only am I trying to gather as much medical history as possible, but I always ask, well, thank them for their service, but also ask them what they did in the military, what was their job. And I found that once I ask that, they just open up. And it's just a great opportunity for them to talk about what they did. And it gives me an idea of who they are, who they were, compared to who they are now. It seemed to be very uplifting for them to be able to open up and talk. I had a veteran yesterday who I was intaking for the first time, and he said, "This is the first time I've ever talked this long to anyone on the phone." That's the challenge that they face. They're either alone, they live alone, or they live in a family setting, but they feel lonely. So they're two different things, it's very enlightening. It's you need to be able to identify, okay, what is it that they're feeling? Are they feeling isolated, or are they feeling just lonely being in a family situation?
And I imagine that the two different feelings also would require very different approaches.
Definitely. And I think where it all starts is when you're in the military, you have that camaraderie, and you eat and sleep and train and work with and protect your brother or sister in the service. But then when you are discharged and when you're back into civilian life, you don't have that community, you don't have that family setting anymore. So they miss that camaraderie, they miss the physical activity, they miss a lot of that, and it's very difficult for them to adjust to civilian life. Even if they have a family, it's much worse when they have no one to go home to.
How has your work at the Palo Alto VA Medical Center informed your perspective on addressing loneliness in veterans?
I found that the older they are, the more depressed they are and the more lonely they feel. And the loneliness isn't, it leads to clinical conditions. So it leads to depression, anxiety, substance abuse issues, and suicidal ideations. So it's very important to address the loneliness before it leads to all these other conditions that need to be treated and can lead to worse things. The depression is very, there's a clear association between depression and heart disease. So we do want to address the loneliness and the depression and all that mental health, these mental health issues, because it's going to lead to these physical problems in the future.
Wow, I didn't realize that about the tie between depression and heart disease, but that definitely makes sense.
Mm-hmm.
Can you speak to any of the triggers that maybe kick off feelings of loneliness or really amplify those for the different veterans that have transitioned maybe into civilian life?
Yeah, so I would say having a disability, having a disability and having difficulty just performing activities of daily living. We call those the ADLs. They're having trouble, and the more lonely the veteran is, the more they're apt to withdraw. So
Mhm.
it's even more difficult to get them the help that they need because they are withdrawing. It really takes someone to be able to identify that and draw that out of the veteran, then seek help. So, it really is up to the clinician to see what's going on and kind of pull some information from the veteran. If you're in a 10-minute appointment, you can't always get that information. So the beauty of the program that I found, because I'm with a patient for anywhere from 30 minutes to an hour, so they spill a lot of they tell me a lot of things, and I think that was the plus side of what I found with this program, because being in a hospital setting, being with a group, they did have that group dynamic, which I thought was very positive, but they didn't have that. We didn't get deeper into the issues that the veteran faces.
And I think groups are so helpful, but you can get lost as an individual in a group. You can skim under the radar, or people
Yes,
might not notice when one member of the group is struggling. I can see why one-on-one
exactly.
interactions would be so
That's
nice.
exactly right. And there's that stigma of needing help, and especially among your peers. They don't want to appear that, or the stigma of mental health is another thing too. So they
Oh,
don't
yeah.
want to be seen as or judged as being weak. And the more you've been in battle, the more hardened you become and very resistant to letting go of your feelings. So yeah, it's true. The group setting is good for the social interaction that a lonely person needs, but they do need that one-on-one time, especially the veterans that they're a whole different breed compared to the civilian.
And I think too, along with that stigma is like there's sometimes I feel like a sense of shame that they feel for feeling lonely or feeling isolated, or that feeling that they're weak maybe,
Yes.
when those are just natural human reactions to things that happen in life. And then, of course, the dangers of that are the reactive behaviors and different ways of coping that lead to health issues and mental issues down the road. And you can correct me if I'm wrong, but the longer somebody goes without that kind of connection or goes without acknowledging it, the more difficult it probably becomes to then go about correcting it and seeking help.
That's absolutely true, because they kind of get deeper into that spiraling down into a real deeper depression And like I said, that even though you may have family, I have a veteran who lives with his daughter and son-in-law and two grandkids, and he's terribly lonely.
Mm.
I finally got him to say that. He said, "Yeah, nobody talks to me. I don't get invited out to dinner, or I don't get invited to the kids' activities," and he feels very isolated, even though he's
Mm.
living in a home, which is more than some other veterans have. And I think the other thing is veterans kind of look at, well, there's always somebody worse than me, so I shouldn't be complaining, or I shouldn't have this issue because there's always somebody worse off.
Yeah.
And that could make them even more hesitant to reach out for help.
Veterans are team players to a fault, and they will definitely look out for their buddies before they look
Mhm.
out for themselves. But
Yes, so true.
how, in your experience with speaking with these veterans, how do we promote and encourage more open conversations and start building some of that trust and reducing some of the shame and stigma around the loneliness?
I work in cardiology. My job is to make them healthy again, or and active. But I feel like the core of my job is to get them to trust me and get them to open up. Because until you build that rapport with someone, it's not going to work. So the most important part in this position is to build rapport. The person that is connecting to the veteran has to have some sense of compassion and some connection somehow that they can relate to and feel comfortable, and then go from there, because then you can open up doors that way.
How do you go about building that rapport and that trust with your clients?
First is kind of getting them to open up. And I often tell people, because they say, well, what do I tell a veteran, like on Veterans Day, or what do I say? They feel like just saying thank you isn't enough. I said, well, try and start a conversation. Ask them, like I do with my intakes, ask them, well, what did you do when you were in the service? And what was your job? Because everybody has a job, and ask them about that. Give them something to talk about. Otherwise, they won't open up. They're not going to brag, or they're not going to say, I did this, I did that. They're not that, veterans aren't like that.
Yeah.
So it's real important to reach out and try and draw them out. They're very good at withdrawing when they're lonely.
I know you mentioned that some of our older veterans struggle quite a bit
Mhm.
with this particular loneliness epidemic. Are there other demographics that have a specific or unique struggle in this area as well?
Those with PTSD,
Mhm.
definitely, because they are dealing with a whole nother issue. A lot of my patients right now, I'd say the majority of them are Vietnam veterans. So, and they are still dealing with chronic PTSD. That was something that really surprised me, in the sense that after all these years, they're still dealing with it. But then you
Right.
think about it, back then, nobody
Yeah.
was dealing with it. And they were treated so poorly when they got home. So they had that layer to deal with when they got home. The nightmares, the PTSD, all of that is still really prevalent in our Vietnam veterans. PTSD is also very prevalent in the post 9/11 veterans, as well. But we're losing a lot of our Vietnam veterans. They're getting older in
Right.
age. They have a lot of chronic illnesses.
Mhm.
Not only are they lonely, but they have the clinical conditions, and they're causing them to lose their life early. And it's
Yeah.
mostly cardiac and
Mm.
pulmonary, and then
Mm.
cancers. So,
Mhm.
lung cancer, pulmonary issues, exposure to Agent Orange, and
Yeah.
just the trauma. And trauma is another part of the whole loneliness issue, because they're
Mm.
dealing with that in their heads and not really opening up to anybody else. I
Yeah.
try to, when I identify a patient with all these issues, I do refer them to a mental health clinician, as well as alert their primary care physician as well, to try and get them as integrated as possible.
Yeah, which is one wonderful thing about the VA is your doctors can kind of rally together for
Mhm.
you, which is
They do have a team that
yes.
every patient has a team of people that works with the patient, which
Yeah.
is great, which is great.
Speaking of the trauma aspect, I mean, that's such a good point because trauma is another area of where people don't always want to talk about it. They don't want to open up about it because either it was something that they think they're responsible or they should be ashamed of. In some cases, they have moral injury, which is, where they partook of or saw something that was grievant against them as a human being, or even just being in an environment of such fear.
Right.
But
Mhm.
again, with trauma, you don't feel like you can just talk about that with anybody. Can you speak a little bit about how maybe some people, the caregivers, family members, or the general public can kind of help support more veterans in maybe in everyday ways? Because you're not going to always be able to get somebody to talk about their trauma. What are some ways that like maybe an outsider could be engaged and help somebody who they think might be struggling with loneliness?
I think that when a veteran is suffering from loneliness, it needs to be a family affair, if there's a family. Because, I have one veteran who said, my family thinks I'm an irresponsible adult. That's what they call me, an irresponsible adult, because I can't focus. To me, from as a clinician, I said he's got obvious signs of depression, anxiety, and definitely loneliness. But the family doesn't understand it. They don't understand what this Vietnam veteran went through, for one, and how his service is the cause of these health issues that he's suffering from right now. When the person comes home, they just say, okay, we're back to the way things were. Well, that's totally different. The veteran has experienced trauma or just something that they have no idea how to deal with or comprehend. So, number one, compassion. And then trying to, if we could have these outreach programs for the families, they would know how to deal with it instead of saying, you're just an irresponsible adult, you just can't do anything. So that would be number one.
What kinds of programs do you think are helpful for veterans who are struggling with loneliness or isolation? What kind of programs would be helpful for them to partake of that already exist? And then part two will be, what do we think that we could do better?
So there are several pet therapy, music therapy programs. There's also a program, I don't know if you've ever heard of it. It's called Compassionate Contact Core. It started out as an in-home visit type program, and then when COVID hit, they had to adapt, and it became a phone and video visit. It's comprised of volunteers who are trained, and they reach out to a veteran and talk to them for maybe 15 to 60 minutes a week. And that's their way of trying to draw out a veteran and creating a trust and just having them having some contact with the world. And it's a very popular program. I think about 80 VAs have it now, and it's growing. But I love that because I kind of feel like that's what I do, because I'm calling the patients every week and we do a lot of talking, and how therapeutic that can be just to talk. And like I said, sometimes I'm the only contact they have for the entire week.
I know at DAV we have a couple of sports clinics that we do for disabled veterans, but I know we also have a lot of volunteering opportunities. And you did mention volunteering on that aspect. Do you feel like getting involved with volunteering is another way that veterans can potentially combat that sense of isolation?
I have actually encouraged some of my veterans to be volunteers because when you help other people, it makes you feel better. And like you said about when you're in the military, you're always thinking about protecting your brother or sister before your own self. I think that's a very therapeutic program opportunity in itself. Every time you give, you always feel better. So when people are depressed, I say, okay, well, what can you do to help somebody else?
What other kinds of programs and initiatives do you think would be beneficial for this particular group of folks?
As a clinician, when I spot a patient that not only needs physical help outside of what I can give, the VA, at least our VA, has other recreational therapy programs. Tai Chi is really popular because, especially if they don't have really good balance and they can't move really fast, Tai Chi is a really good therapy for them.
So, how can groups like DAV support veterans who live in rural areas and just make sure they have the support to get past those additional barriers to social interaction? What are some ways that organizations that support veterans can help them out more?
That's a great question, and it's a challenging one because getting to those veterans in those rural areas, I mean, and it's not just rural, it's the ones in the urban areas are just as lonely and isolated. The rural area ones are just harder to reach because getting places is difficult for them. Even though the VA does provide transportation, some of them, I've had some that are quite a ways out there. The DAV could outreach. I mean, we need to reach out to them because they're not going to reach out to you, most likely. So there just needs to be a way that they know more about what you do, what you can do, how it could be fun. In our program, we set goals every week. One is for exercise, and the next is for nutrition. The third is a psychosocial goal. And they always ask, well, what is that? I said, well, that's your goal to have fun. So every week, we need to set a goal of what you're going to do to have fun. And that is one of the hardest ones for them to think about, or even figure out. I said, well, I can't do this anymore. I can't do that anymore. I said, well, let's start thinking about what you can do and then work our way up. Those psychosocial goals are really, really important, particularly for the lonely veteran, because they've kind of given up on having fun and being around people.
That's a challenge because once you've reached a rut or once you're
Yes.
in a place that feels comfortable, it's scary to jump back out of that and do something that maybe you're not familiar with and you're not sure it is going to be fun and
Right.
the time
Getting out of your
requirements and
comfort zone is
yeah.
difficult. And just like the veteran that is now in civilian life, that is definitely out of their comfort zone. And then asking them to do other things outside of that's difficult. I really think it's important for the clinician to identify, to spend a few more minutes to say, okay, this would be a good program. He needs this compassionate contact core. We need to channel him over there. This person needs some mental health support. So yeah, I feel like it kind of does rely on someone that makes that first line of contact to draw that lonely veteran out.
I like the idea of giving them a goal too, because in that way it's telling them, listen, this is what we're seeing from the outside, and we think that you can make an improvement, but it's really technically on you because this is your goal. And so like they will have to take that motivation and find that motivation within themselves. And so that when it happens, when they do start doing the thing, it will feel more meaningful because it was something that like they had some control over and some say in.
People in the military, they're very mission driven. So I keep that in mind. And I mean, some of the first things after our intake is that, okay, they said, okay, well, what's next? What are we going to do? And I said, okay, this is lay out the mission and then they get it. I think that's where some of our veterans kind of fall off when it comes to trying to integrate into the workplace because employers don't always get that. Our veterans are very mission driven. Lay out the mission, they will follow through, they will come through for you.
What message would you like to share with veterans who are feeling lonely and maybe don't know where to turn?
Veterans, when they're lonely, lots of times they're in denial. So they don't even recognize that this is what they're feeling. But if they're not happy, if they're sad, there is help out there. They don't have to deal with that by themselves. There are people that are willing to help, and they don't need to be alone in their struggles.
I've often heard the phrase, at least in the professional realm, fake it till you make it. Is that something that works with like motivation and loneliness too, of like getting up and getting ready and forcing yourself to like get back into routine? I know that routine itself doesn't necessarily translate to loneliness, but is that a way to like start breaking out of the isolation shell, is to fake it till you make it?
Yeah, that's a good one. That's a good one. And forcing yourself to get up and get dressed. Movement is a really
Mm.
good remedy for depression. So yeah, and it's good for the cardiovascular system and all that, but it's really good for getting out of depression. Because I
Okay.
did another study on happiness, and they found that people that force themselves to smile were happier. And what they did was that they had these subjects put a pen in their mouth, which forced them to smile, and they tended to be happier people.
That's so funny how that works.
Yeah, so the fake it till you make it, yeah,
Yeah.
that works. It
That
can work.
works. Well,
Uh-huh.
and there's something about getting up and like feeling like a good version of yourself and like you're ready to encounter the world in case you have to.
Yeah.
That does make you feel a little more ready for it, I guess.
That does take some doing. That's why having these weekly visits with our patients, setting those goals, laying out the mission and following up the next week to see, okay, how'd you do? And they don't always like to say, oh, I didn't do it. They get a little embarrassed. Yeah. I said, okay, what happened? How could we fix that? And we set another mission for the following week. But always having a sense of hope. If you don't have hope, you're not going to be looking forward to the next day. And it's optimism is so important.
Yeah.
And that's one of the things that I often hear after my initial intake with a patient. And say, okay, this is what we're going to do, and this is how I see you at the end of the 14 weeks. And all of a sudden they say you could hear it in their voice that I might be able to do something better. I might get better and I might feel better. And that's huge.
That is really huge. And that's such a wonderful thing to see in such a short amount of time, as like somebody feeling better and feeling
Mhm.
motivated and
Mhm.
having the difference already there.
Yes. Yeah. It's it's
Um,
uh it's someone believing in them that really makes a big difference. And then they start to believe in themselves.
I love the concept of like believing in them.
And so having that understanding, not being called an irresponsible adult, because you
Right.
can't
That's what I was
do
thinking. Oh,
certain
yeah.
chores, you can't do certain things or follow through with things yet. That's real important.
I've really enjoyed learning about some of the different programs and the different methods that we could take to approach this epidemic. But is there anything else that you would like to share about this topic of veteran loneliness?
A lot of our veterans were very athletic in their past. I always ask, what are your hobbies? Well, oftentimes they'll say, well, I used to do this, but I can't do that. I used to do. I said, okay, let's start lay it all out. Let me hear what things you used to do, and let's see what we can eventually do. I love these sports programs that the VA and about the DAV, all these programs that bring veterans together, because you have this instant built-in buddy system. That's what happens when you have a sport and you have a team. And not only that, but they're exercising. The exercise releases these great hormones, these endorphins, and they're feeling good, they're happy, they're with other people. The more we can do that, with the skiing and the kayaking, the basketball, all these things are great. And the more we can do that, we can find these little pockets of people. And the more we can reach out and say, hey, come and try this, let me hold your hand and let me help you. They'll learn to love it.
I appreciate you being here so much and taking the time to talk to us about this important topic. If veterans want to look up some resources or information about the condition, about loneliness and isolation, do you have any recommendations on where they might look?
So if you were to go to the VA website, va.gov, and you plug in loneliness, it will populate some organizations, things, and articles that will spark some interest. But that would be a great start. And there's also a volunteers site. If you wanted to be a volunteer for the Compassionate Contact Corps or be a volunteer in any other way, that's a great place to go.
If you'd like to find more resources for veterans experiencing isolation or loneliness, go to va.gov/reach/challenge/feelings of isolation. And to learn more about DAV, you can go to dav.org and check out all of our content. You can also join DAV. Just type Join DAV into Google and follow the prompts from there. Thank you for listening in, and we'll catch you next time.